A friend of mine asked me a few days ago about whether getting the vaccine could cause you to test positive for COVID, and that's an interesting question. And I looked up a couple of articles and YouTube videos about it, and they basically all say no. And that is the correct short answer. The short answer is no. Vaccines will not cause you to test positive for COVID. But the actual answer is a little more involved in that because there's a couple of ways that you could test positive after the vaccine. And the reason that is because there's so many different tests for COVID. There are several different modalities and several different targets. So let's go through them. There's basically three COVID tests. One is the most common test. That's the nasopharyngeal swab, where they do a PCR test. And in that test, they are looking for a specific sequence um, in the RNA, what they find, what they from their sample, and if that sequence is amplified and matches the a COVID sequence, then you test positive. So that test is the most common test. It's very, very, very unlikely that you would test positive with a PCR test after getting the vaccine. And here's why. The vaccines use the spike protein, and they inject the spike protein into your deltoid muscle. So most of the spike protein nucleic acid will show up in your um, in your deltoid. There is this remote possibility that some of it could go intravascular and go into your nasopharynx, and it might get picked up by a swab, and it might get amplified. And there's several reasons that make that almost impossible. One, it's it's very unlikely to go intravascular and make it into your nasopharynx. Most of it will be intramuscular. So the amount that shows up there will be extremely small and very unlikely to be picked up. And then number two, most of the PCR tests test for the nucleocapsid, not the spike protein. But if there was a test that uses the spike protein and you happen to go intravascular and you were tested fairly soon after the vaccine, there's like probably like a 1 in 10 million chance you could test positive. The other way is so the other kind of COVID test is an antigen test, and that looks for the protein. Most of these are also looking for the nucleocapsid, but some of them might be looking for the spike protein. If it's looking for the spike protein and they're drawing your blood and you get that test done within a few days after vaccination when you're making the spike protein, there is a decent chance that you could be making enough spike protein that makes it into your bloodstream that could be picked up by one of these antigen tests that are looking for the spike protein. So I would say for an antigen test, which is not one of the more common tests, if it is looking for the spike protein and you get tested within a few days after your vaccination, there is a very slight chance you could test positive. And then the last COVID test is the antibody test. And the antibody test tests for either antibodies against the spike protein or the nucleocapsid protein. If they're using that test, and that's usually not a test that's being used that people care about, because the reason people care about testing positive is like if you're going to go to Canada or if you're going to go to Hawaii, they want a negative test before you can go there and before you can like leave your plane or your hotel. That the antibody test is never used for that, and I think almost all of them use the PCR test. So basically, you shouldn't worry about that. But if someone is using the antibody test and the antibody test is looking for antibodies against the spike protein, you will test positive for that because you will make antibodies against the spike protein. So, does vaccination cause you to test positive for COVID tests? Um, Short answer is no. And for the tests that matter, no. But there is a chance that you could test positive for the antigen test, and you will test positive for the spike protein antibody test. But those are not the tests that are used for travel, which is what most people are concerned about.